Hey guys, Sam here from Live Well Health Centre, and today we're going to be talking all about jaw pain. So the biggest misconception that we see with jaw pain is that people come into us saying that they have headaches or pain because they have TMJ. And unfortunately, that's a bit of a misconception. We all have TMJ. The TMJ is actually the joint. So if we look at this model of the skull, if we turn it to the side, we can actually see our TMJ just here. So your TMJ is your temporomandibular joint. Your mandible is the bottom part of the jaw, and where it attaches into the skull, so the top part here, is your temporomandibular joint. So we all have one on each side. If there is an issue within the space, we call it TMJD, which is temporomandibular joint dysfunction. So like any area of the body, unfortunately, we can have issues and dysfunctions within there. There's three kind of areas that we look at as osteopaths. The first one being the muscles. So we have four main muscles. We call them our muscles of mastication. Again, they help with talking, chewing, all those kinds of things. And the first muscle that we look at is your temporalis. So your temporalis is the big muscle that covers the temple area, just through here. The tendon actually comes down underneath that joint space and can become impinged. The next one we look at is our big masseter muscle. So your masseter is your big cheek muscle. That can get really tight, really fatigued, and actually suffer from overuse injuries. And then if we look inside the jaw, all the way at the back here, we have two pterygoid muscles, which are really small and do come under a lot of strain from opening and closing. So there's lots of soft tissue joints techniques that we can do throughout that area to release those joints. We can do our dry needling, just like we do with any other area of the body, and we can also do some joint manipulation and what we call MET techniques to really get the jaw nice and strong to stop that pain. The other area that we look at is the joint itself. So as the joint sits in there, just like any other joint in the body, it can suffer from arthritis or joint sprains. So using very similar techniques that we would when there's a muscular injury, we want to make sure that that's nice and loose and the muscles are nice and strong so that there's a little amount of pain as possible within there. And the third area that we look at is actually this small little disc in here. So that's called your articular disc. What that disc does, it actually stops the bones from rubbing on each other. So as we open our mouth, that disc will slide back and forth to stop any rubbing of the joint. So the biggest issue that we see with that disc, if it slides too far forward, it can actually get stuck there and not come back into its joint space properly. And that's when you get clicking and grinding, you suffer with lockjaw and those kinds of injuries. That one can be a little bit more difficult to treat, but again, focusing on the muscles, make sure everything around it is moving really smoothly, and sometimes it can slip nicely back into place. The issue with the TMJ is that there are a lot of psychosocial factors involved. So a lot of the time when there are muscle injuries through here, it'll come from grinding, clenching our teeth, and those kinds of things. A lot of the time they happen subconsciously overnight, so it can be really hard to control. So we want to make sure that there's lots of education involved with your consultation. Make sure that it's really in depth so we know what's potentially leading to it, and that way we can refer accordingly. If it is something a little bit more serious where there's arthritis that's just something we can't get under control, or if that disc is really sitting too far out, at Live Well Health Centre we have some great referral patterns from local specialists and local dentists that we can refer you to make sure that you're getting the best care. So outside of hands-on manual treatment, other things that you can expect to see with TMJ pain are prescription muscle relaxants from your local GP, or as I said, your dentist. That can be really good for just allowing that jaw to have a little bit of a break and those muscles to relax and just calming down the pain a little bit. Botox is a really common treatment for TMJ pain, and I know that can sound quite confronting, but it's not a cosmetic procedure. It doesn't change the look of your face at all. Again, it's just working mainly with that masseter muscle, that big one in there, and then our pterygoids in deep inside. And again, just essentially freezing those muscles, allowing them to relax and just have a bit of a break so the joint itself can have time to heal. If it is more serious, we can also go for surgery in that area. So occasionally what they do is they will relocate that disc, or they even put a little bit of an implant in there and remove the old one to stop it from getting caught. So there's lots of techniques that we can do for you as osteopaths and lots of ways that we can help you. So if you feel like you're suffering with TMJ dysfunction, give us a call or book online and we can help you out.